In this video, I'm going to talk about cardiac cycle. What is meant by cardiac cycle? Cardiac cycle is the set of events that takes place in one beat. Remember this word? One beat of heart. One beat. Okay? All the events that takes place in that one beat is called cardiac cycle. And this cardiac cycle is initiated by sinoatrial node. Sinoatrial node initiates the cardiac cycle. Okay? And the sinoatrial node is present in the right atrium. And that too the lateral wall. This is lateral wall of right atrium. This is medial wall of right atrium. On the lateral wall of the right atrium at the level of opening of superior vena cava. See this opening of superior vena cava. The sinoatrial node is present and it initiates the cardiac cycle. Okay. Now the sinoatrial node produces action potentials. These action potentials from sinoatrial node SAN first goes to the both atrium, okay, both atria, and then from atria the action potential goes to AV node, and then from AV node to ventricles, and from AV node to ventricles there is one pathway, like from AV node the AV bundle of His, and then Purkinje fibers. That is not important. Okay, the usual pathway is sinoatrial node, atria, and then AV node, and then ventricles. Okay, this is how the action potential travels from sinoatrial node to ventricles. Okay, see, while traveling the action potential from sinoatrial node and to the ventricles, there is a delay of 0.1 second. Delay of 0.1 second. Why there is delay of 0.1 second? See, first the action potentials from sinoatrial node goes to atria. Okay, so atria contracts. Both atria contracts, and then there is delay of 0.1 second across AV node, AV bundle, and then after 0.1 second the ventricles contract. Why it is important for this delay? Because when there is a delay, the ventricles will fill to a sufficient amount. Okay, so if there is no delay, then ventricles would have contracted early or along with atria. Then there is no chance of filling blood. Okay, first atria contracts and then ventricles contracts with a delay of 0.1 second. The need of this 0.1 second delay is the sufficient filling of blood in ventricles. Okay, and then the duration of cardiac cycle. See, the duration of cardiac cycle is reciprocal of heart rate. Reciprocal of heart rate. Consider the normal heart rate of 72 beats per minute. See what I'm mentioning, beats per minute. Remember this word, beats. The entire cardiac cycle is the events that takes place in one beat of heart, right? So that one beat, the events are called cardiac cycle. See, beats per minute. Keep this unit in mind. Okay, 72 beats per minute. Now put 72 under 1. It's almost like equal to 0.0139. Remember this unit. What I'm saying, minute per beat. Okay, minutes per beat. Just reciprocal of this unit. So this is minute. Okay, we have to convert this into seconds. If we convert this into seconds, it's almost like 0.833 seconds per beat. So the entire duration of cardiac cycle is around 0.8 second. Okay, you can round off to 0.8 second. This is the duration of cardiac cycle. And now we'll go to phases of cardiac cycle. There are two phases. Okay, one is systole. That means contraction. Here the systole includes both systole of atria and ventricles, and the second phase is diastole. we can say it's nothing but relaxation phase. This is contraction phase, this is relaxation phase. And again, under systole there is atrial systole and ventricular systole. Again, in diastole there is atrial diastole and ventricular diastole. Okay, the duration of atrial systole is around 0.1 second, and the duration of ventricular systole is around 0.3 second. The total duration of systole is 0.4 second. See, the duration of atrial diastole is 0.7 second long. Usually the systole phase is short. Okay, it's you can call it as a rapid phase or short phase. And the ventricular diastole takes place in around 0.5 second. This is also long. So you can see here the atrial systole and ventricular systole together leads to diastolic phase. It's around 4 seconds. Okay, and then if we add all, we should get 0.8 seconds, right? It's not like that, because some of the phases, atrial systole, ventricular systole, these diastole, these all phases overlap with. Okay, you can see this diagram. You can see the overlapping. Now see the red color shaded portion. Red shaded portion is atrial systole, and it's around 1 second. Okay, this is 1 second. Every part of this, like every partition in this circle is around is 1 second, amounts to 1 second. Okay, so I have shaded only one part, so it is equal to 0.1 second. That is atrial systole. Just after atrial systole, the ventricular systole starts. The ventricular systole is shaded with green color, and it's around 3 seconds. See, just after the completion of atrial systole, the ventricular systole has started. So there is no overlap between, as that much overlap between. We can almost say they are separate phases. Okay, so atrial systole and ventricular systole almost occur separately. So 1 second plus 3.3 second, 0.1 second plus 0.3 second is equal to 0.4 second. Okay, this is the systolic phase. And now comes to ventricular diastole. See, after ventricular systole, which is in green, ventricular diastole starts. Ventricular diastole, which is shaded in purple color. Okay, you can count the boxes: 1, 2, 3, 4, 5. 5 portions, right? 5 parts. So it's 5 seconds. And then atrial diastole. The atrial diastole starts after atrial systole. You can count the parts: 1, 2, 3, 4, 5, 6, 7. So it's equal to 0.7 seconds. Okay, so this is the diagrammatic representation of the phases of cardiac cycle. Okay, which occurs in a duration of 0.8 seconds. Now let's discuss the core discussion of the cardiac cycle. Okay, it's the main part. So see this diagram. There are many curves. Just see this diagram, and I will discuss each curve in this diagram separately. So let's discuss this graphical representation or curves in a broad manner. And see here, the top three curves, like, see, 1, 2, and 3. These top three curves represents the pressure changes. What's pressure? Remember this word, pressure changes in first curve. See, I have marked first. This curve represents the aortic pressure changes. What? One we can write as pressure changes in aorta, the first curve. And I have marked this as second. The second curve represents the atrial pressure changes. What is that? Atrial, both atria. Okay, atrial pressure changes. And finally, the third curve. These three are top three curves. Third curve represents the pressure changes in ventricles. So basically, the top three curves in this diagram represents what pressure changes in the aorta, atria, and ventricles. Okay, and now comes to the, let's go to fourth curve. This is the fourth curve. This fourth curve represents the volume changes in ventricle. So for discussion purpose, let's consider the left-sided heart. Okay, we will consider only left atrium, left ventricle. Okay, so this is the volume changes in ventricle. For discussion purpose, we will consider left ventricle and left atrium. Okay, left ventricle. Let me write left ventricle, or just volume of ventricles. Fourth curve deals with what? Volume of ventricles. You can see here. See, volume, ventricular volume is represented by fourth curve. And now fifth curve, you can easily say it's echocardiogram, ECG. Fifth curve says ECG, electrical activity of heart. And finally the sixth curve. This is the sixth curve. This is about phonocardiogram. What is the meaning? It is all about recording the heart sounds. It represents phonocardiogram. Sixth curve. Cardiogram. It represents what? Heart sounds. See, the heart sounds are like 4 heart sounds are there. Let me discuss them later. For now, just know that the heart sounds are created by closure of the heart valves. Remember this word? Closure, not opening. It's the closure of the heart valves. Which are heart valves? The two atrioventricular valve and tricuspid valve and bicuspid valves. Semilunar valves and AV valves. Okay. The closure of these valves leads to the production of heart sounds. So that is recorded by phonocardiogram, and that phonocardiogram is represented by sixth curve in this diagram, as you can see here. Okay, this is like a broad overview. Okay, and now let me discuss each curve separately. So let's discuss ECG first. ECG. So what is ECG? Look, it's nothing but the recording of electrical activity of heart. You should remember this sentence, okay? I'm going to tell. The electrical activity of heart occurs first and then the muscular activity occurs later. Like you can tell like this. The depolarization occurs first, then the contraction of heart musculature occurs later. First depolarization. Same way, the repolarization occurs first and then relaxation later. First, what happens? Depolarization. Or repolarization. These two are electrical activities of heart rate, like concerned with electrical activity of heart. Repolarization and depolarization. These two occur first and then the contraction or relaxation okay. First depolarization occurs and then contraction occurs. First repolarization occurs and then relaxation occurs. So it is always the contraction or relaxation that follows these two electrical activities. So this is one statement you should remember. And you know the waves of ECG, P, QRS and T waves, right? Now I'll discuss each wave. So let me discuss first the P wave. I told you, first you should consider the electrical activity and then muscular activity like contraction or relaxation. P wave, see what happens during P wave. See here, P wave, this is P wave, right? See, first there is depolarization of atria, left atria. For now discussion purpose, I'm going to consider only left-sided heart. Depolarization repolarization of left atria. Okay, and this leads to first this thing happens, this first occurs, and then later what happens? Contraction of left atrium. Left atrium. Okay, see this peak. After this P wave, you can see this atrial pressure curve. Atrial pressure curve. Just after this, there is increase in, see, there is increase in pressure in right atrium. That means right atrium is contracting. So we can write it as after P wave, just after P wave, completion of P wave, left atrium starts to contract. What happens if it contracts? AV valves are closed, and left atrium is also contracting. So this leads to increased pressure in left atrium. So this is the curve. See, just after P wave, there is increase in left atrial pressure. Okay, there is increase in left atrial pressure just after P wave. So after P wave, the QRS complex comes to play. What is QRS complex? Second one. QRS wave corresponds to depolarization. Don't forget this. First depolarization and then contraction. Okay. First depolarization of left ventricle, and then occurs contraction of left ventricle, LV. So you can see this diagram. See, this is the QRS wave, right? So almost here we can see, track this line. Yeah, this is the, see this ventricular pressure curve. There is increase in pressure of left ventricle. So almost like just after QRS, there is contraction of left ventricle. So there is increase in left ventricular pressure. So what happens? Just after QRS in ECG, there is contraction of left ventricular pressure, and then there is increase in pressure of left ventricle. See, after the contraction of this thing, left atrium, there is a isovolumetric contraction. Like the atrium pushes extra so that the AV valve opens. So after contraction, there is opening of AV valve, and then there is flowing of blood from atrium to ventricle, and again left ventricular depolarization and left ventricular contraction. This is the usual thing you also know. So see here, there is increase in pressure. So now what happens? The AV valve is closed, right? Now there is pressure buildup. You can see in this diagram, just after QRS complex, there is beginning of increase in left ventricular pressure. So by this diagram, we can compare the ECG with this thing, left ventricular pressure curve. So this is about QRS. And then T wave. T wave is what? I told you, first is electrical activity, concentrate on that. Now comes to repolarization. First, what happens? Repolarization of left ventricle, this leads to later what happens after repolarization? Relaxation of left ventricle. Okay. So if left ventricle is relaxing means what happens? There is decrease in pressure in left ventricle. And this T wave when it occurs means almost just before the end of left ventricle systole. End of left ventricular systole. See here. See this diagram. See, this is systole. This is the end of left ventricular systole. This is the left ventricular diastole. And within diastole only there is atrial systole. I told you before only there is overlapping. So only the cumulative effective duration of cardiac cycle is 0.8 seconds. So there is some overlap. So this is the systole, right? This is systole. Just before the end of the systole, see, just before the end of the systole, there is T wave. Right? This is T wave. Just before the end of the systole. You can also say it as T wave first occurs, and just after T wave, the ventricular diastole begins, or T wave occurs just before the end of ventricular systole. Okay. So this is about the ECG wave. One curve is over, that is fifth curve. Fifth curve is done. So after discussing the ECG curve, then let's discuss the second one, that is atrial pressure curve. In this diagram, you can see this is the atrial pressure curve. As you can see in this diagram, there are three waves. 1, 2, 3. They are A wave, C wave, and V wave. Okay, and let's first consider the A wave. See this, the phases. This is diastole, ventricular diastole. From this point to this point, this is ventricular diastole, and this is ventricular systole. And in ventricular diastole only there is overlap of atrial systole. During that time only there is atrial systole, because there is filling of ventricle. So obviously there is contraction of atrium. So that is atrial systole and then ventricular diastole. They occur in almost in the same duration. Yeah. So see the A curve, A wave. This wave occurs due to left atrial systole. Systole means what? Contraction, right? If there is contraction, there is increase in pressure in the left atrium, right? Because of this atrial systole, you can see this phase, okay? See here. Atrial systole, because of atrial systole, in this duration, the A wave occurs in the atrial pressure curve. So A wave is over. It's because of A wave occurs due to left atrial systole. So the pressures, see, in left atrium, the pressure goes from 7 to 8 mm Hg mercury. In right atrium, the pressure increases from 4 to almost 6 mm Hg, 5 or 6. And then comes to second wave, that is a C wave. After A, there comes C wave. This C wave, see where C wave is occurring. This C wave is occurring in ventricular systole. See, this is ventricular systole. Ventricular systole. So what happens during ventricular systole? Ventricular systole, there is AV closure, right? Left AV valve is closed. So we can tell like this, because of Because of contraction of left ventricle, there is pushing of this thing, left AV valve. Because of this pushing into the left atrium, there is increase in pressure during ventricular systole in left atrium. Why? Because there is bulging. Why there is increase in pressure? Because of bulging of left AV valve. Why there is bulging of left AV valve? Because of contraction of left ventricular systole. That is contraction of left ventricle or left ventricular systole. Because of this, there is bulging of left AV valve into the chamber of left atrium. So there is increased pressure. So this leads to the production of C wave. See this diagram. This is C wave, right? And this C wave is in what? Left ventricular systole. Yeah. The next wave is V wave. The V wave occurs due to filling of blood into what? Into left atrium, left atrial cavity by veins. Okay. So because of this filling of blood into left atrial cavity, there is increase in pressure. So these are the three waves in atrial pressure curve. So you can see here, this is the V wave. See, almost at the end of see, this is the end of left ventricular systole, right? At the end of left ventricular systole, what happens? There is filling of left atrium to the maximum extent, right? So there is increase in pressure in the left atrium. So these are the waves in the atrial pressure curve. So in this, we have finished one ECG and then this thing, pressure curve of atria. So two curves over. Now let's discuss the ventricular volume curve. That is the fourth curve. See this curve. Fourth curve. That is ventricular volume curve. So yeah. So consider this point, like this point. See, this is the diastole of ventricular diastole, right? This whole duration is ventricular diastole. Just before this, what happens? Ventricular diastole, prior to ventricular diastole, what was happening? So there is the AV valve opening, that is the atria, blood from left atrium goes to left ventricle. So that's where the left ventricular diastole starts, right? Where the blood starts filling in left ventricle. So see here, in the discussion of ventricular volume curve, I'll discuss the volume relationship in 2 points. Okay, one is the rapid filling phase. Rapid filling phase. And the other is outflow. Outflow with respect to what? The reference point is left ventricle. Outflow from left ventricle. So how blood goes out of left ventricle. The first phase is how blood comes into the left ventricle. This is in rapid filling phase. Into what? Left ventricle. Into left ventricle. This is out of left ventricle. Okay. In these two headings, I will discuss. So see this curve. So this is the point. You can see here. See, this is the point where the AV valve. See here. This is the point where the AV valve, left AV valve opens. If left AV valve opens means what happens? The blood from left atrium flows to left ventricle. So 80% of the blood flows passively. Passive blood flow, okay? To what? Flows into left ventricle. So left ventricle in the diastolic phase starts to fill up with blood. So see this point. From here, I'm cross marking here. From this point, the left atria starts to contract. Okay, that is left atrial systole. Left atrial systole. When left atrial systole happens, what happens? Left atrial systole. Remaining how much percentage the blood is left in left atrium? Systole. Left atrial systole. Remaining 20%. Remaining blood is pushed because of force of contraction of left atrium, pushed into what? Pushed into left ventricular cavity, which is still in diastolic phase. See this diagram. So this is the point where the AV valve opens. So once the AV valve opens, the blood from the left atrium starts flowing into left ventricle passively. Okay, there is no contraction of left atrium. Still 80% of the blood flows passively. So at this point, the left atrium starts contracting, that is left atrial systole. So again, see this curve, it was increasing. At this point, there is even more increasing, like this. You can see like this, right? So there is even more, little more increase in the flow of blood, that is another 20%. This is 80%. So at this stage, at the end of diastole, at diastole end, the volume of the blood in the left ventricular cavity is what? 110 to 120 milliliter. This is called end diastolic volume. Okay, end diastolic volume. So yeah, there is blood filled, there is left ventricular cavity filled with blood now, 110 to 120 milliliter. So now what happens? This is called rapid filling phase. I told in phase, rapid filling phase. Okay. So now out of left ventricle, out phase, outflow. From what? From left ventricle. So this occurs in the following steps. So the first step is isovolumetric contraction. What is meant by isovolumetric? Means the volume is constant here. See, at the end of diastole, at the end of diastole, this phase, at the end of diastole, in this phase, the AV valve closes. Okay, at this point, AV valve closes. So what happens? There is no, there is one heart here. See, at the end of diastole, this left atrium, left ventricle, this AV valve is closed. So what happens? There is no opening of semilunar valves, that is opening to aorta. There is no opening, right? It is still closed, the semilunar valve of aorta. So there is volume is constant here. Volume is constant. Then what's increasing? The pressure is increasing. The pressure in the left ventricular cavity increases. So this is called isovolumetric contraction. Volume is constant, but pressure is increasing, that is contraction. So this is isovolumetric contraction. When the pressure keep on increases and it reaches slightly above 80 mm mercury in left ventricle, and in right ventricle same. We can discuss with respect to right ventricle also. For discussion purpose, I am considering the left ventricle here, left heart, left ventricle, left atrium. Okay, about 8, slightly above. When the pressure reaches slightly above this pressure, then what happens? Semilunar valves opens. Semilunar valves of aorta and pulmonary artery opens. Then another next step starts. One is isovolumetric contraction, that is over, that is ended up with opening of semilunar valve. Now what happens? There is ejection phase, ejection of blood, ejection of blood out of what? Ventricle, left ventricle, ejection of blood, ejection phase. So yeah, once the semilunar valve opens, then there is ejection of blood. About 60% of the end diastolic volume, EDV, end diastolic volume, that is 110 to 120 ml. 60% of this, like approximately 70 ml of blood is ejected out of left ventricle. Okay, so remaining 40%, that is around like 40 to 50 ml, will stay in left ventricle only. This is called end systolic volume. End systolic volume. See here, for the blood to eject out of left ventricle means there is left ventricular systole, right? See this diagram. See, up till this, there is we reached end diastolic volume, and now semilunar valves opens at this stage. And now what happens? The volume decreases in the left ventricular cavity, right? See, the left ventricular volume decreases. The blood flows out of left ventricle into aorta and pulmonary artery. Left ventricle and right ventricle respectively. I am here considering left ventricle. The blood goes into aorta, so the volume decreases. So it reaches up to, like, see here, see this point. It's almost like below 50. It's almost like 40 to 50 ml. What is this? End systolic volume, right? End systolic volume. From here, what happens? There is after ejection of blood, there is closure of which valve? Semilunar valve. So what happens next phase? Third phase, isovolumetric. Volume is constant now because all valves are closed. Semilunar valve is closed, AV valve is closed. Relaxation. Isovolumetric relaxation. What happens? Pressure decreases. Relaxation means pressure decreases. Isovolumetric means volume constant. What was volume? End systolic volume. That will remain constant. That is 40 to 50 ml. Okay. So these are the phases of this thing. Outflow. In phases, 3 steps in outflow. Inflow is easy. Yeah, rapid filling phase. So this completes the volume relation. Okay. Volume curve. Ventricular volume curve. See, it started here and reached maximum 110 to end diastolic volume 110 to 120 ml at the end of diastole, and again at the end of systole 40 to 50 ml left in the left ventricle. That is end systolic volume. So now let's go to the next curve, that is phonocardiogram, are the heart sounds. Heart sounds. I told you before only, the heart sounds are due to what? Closure of heart valves. Okay. So there are four heart sound. First heart sound, S1. First heart sound. See this diagram. This is first heart sound. The first heart sound is due to what? See what is happening here. There is a systolic phase, that is ventricular systole. This is the beginning of ventricular systole. So what happens? There is closure of ventricle contracts, that is ventricular systole. Ventricle contracts, pressure increases in the left ventricular cavity. This causes bulging or closure of AV valve. This closure of AV valve due to increase in pressure or left ventricular cavity, this increase in pressure is due to left ventricular systole, leads to production of one sound that is called S1, first heart sound. This first heart sound is, see, a low pitch and long lasting sound. Okay, this is about first heart sound. Now S2, second heart sound. This second heart sound, see here, see this diagram. See, second heart sound is almost at the end of systole and beginning of diastole. End of systole, what happens? At the end of systole, what happens? Ventricular systole. There is closure of semilunar valves. Valves of aorta and pulmonary, anything. Now we are discussing left ventricle. So closure of semilunar valve at the end of ventricular systole. Okay. So this leads to rapid snap sound, and this is short one, this is short one, and this is long lasting one. Now S3 sound, the third heart sound, it occurs due to the hitting of blood flow to the walls of left ventricle. So this is nothing but the vibrations that occurs in the left ventricle due to the back and forth movement of blood flow. Okay, yeah, this is third heart sound. When blood rushes from left atrium to left ventricle due to the going and hitting of the blood flow to the left ventricular wall, there is one production of sound. This is called S3. The S4, the fourth heart sound. This is due to the rushing of blood. Don't forget this word, inrushing of blood from left atrium to left ventricle. See, I told you, in left atrium contributes about only 20% of the blood filling. Remaining 80% of the blood filling occurs by passive, right? So imagine there is a decreased compliance of left ventricle. Compliance or increased resistance in what? In left ventricle. So if there is these two conditions, then the blood just can't fill up till 80% passively, because there is decreased compliance. Blood can't fill up to 80% passively. So what happens? There is increased beneficial effect of left atrium. What is that beneficial effect? Left atrial systole. So this is the compensation. Okay. If blood is not able to fill till 80% because of the decreased compliance or increased resistance in the left ventricle, means someone has to fill that blood, right? That someone is nothing but left atrium. Does that work by what? By contracting, that is the left atrial systole. So yeah, This fourth heart sound is heard in like left ventricular hypertrophy. Okay.